Hi, everybody. It's Kevin and it's Donna, and welcome to an episode of the Med List. Donna, I missed you last week. We had a great guest on, but you were out there just world traveling, right?
Yeah, I was in France and, rubbing elbows with all the great prescribers of our world. So it was great. And we have a lot of wonderful guests in our future that are going to be talking with us, and their studies and research and what they do is just fascinating. So more to come on my trip to France.
Oh, I love it. Yeah, I think that world perspective is so interesting when we think about our little microcosm of healthcare in each kind of pocket of the world and the way we do things differently. But I think one thing that's so fun about our current guest that we always love with Janet
Mhm.
is no matter what deprescribing world you come from or country you come
Yeah.
from, we always need more movement. And
Mm.
having someone with 30, I can't believe this, but 30 years plus of experience, kind of looking at how do we avoid medication utilization and get folks to move is always a real pleasure. So, all you folks that are looking to decrease medications, move more, feel better, Janet is up next. Talk to you guys in a second. I don't even know if Janet needs an intro any longer. She's just like
No,
she's part of the crew. We should just have her come every week. I'd
it
love it.
There's one really neat thing about Janet since we've last spoken with her. I think I have this right, Janet, is that you are now a certified health coach. Is that new since the last time we spoke?
Well, I was certified for the past 10 years by Well Coaches, but I just got the national board certification. So, what's really cool about that is that there's a national standard for health coaches. Like anyone can call themselves a coach, any kind of coach, life coach, whatever. But for health coaches, now we have this national standard, which is very, very cool. They're doing some great stuff. So, I'm so happy to be national board certified, get to add those credentials next to my name. But it really means that we're standardizing this field, which is so important.
What does it mean, Janet, from like a patient's perspective or another collaborating clinician's perspective, excuse me, to become
Yeah.
nationally kind of board certified?
Yeah, I think it shows a standard of care. There's a lot of different certification programs for coaching, health coaching, wellness coaching. So I think if a clinician was going to refer somebody to a health coach, if you look for the national board certified health coaches, they're going to have, that they have been trained by a certain standard, like an accredited program kind of thing, right? Like if you have an accredited pharmacy program, then
Mhm.
there's standardization. So it standardized the field, and yeah, it's really it's great. I want it to happen in the exercise field. We have a little bit of that, but in terms of the ACSM, CEP is our standardization in the nation for that. So, but for health coaching, it lets clinicians and individuals find somebody who has the right credentials and training that
Oh,
they
sweet.
need to really get the most out of their time with a coach. Yeah,
That's
Makes a
awesome.
ton of sense.
And Janet, I
yeah,
think it's important to know too that you weren't just like grandfathered in. It's
yeah.
just like every health
No,
coach is all of a sudden, here's
no,
the standard. You actually had to do work in order
yeah,
to
yeah,
get that certification still. So it's not just
yes,
like, oh, I've had this, so therefore I have this. You had to
yeah.
actually work at it
Yeah.
for sure.
Yes, I took a
Very
year of extra classes and practical and all kinds of stuff. Yeah, it was because it was 10 years since I got certified. It was so great. The process was so great just to refresh, and met so many great people, and yeah, it's awesome, and I'm so proud of this field. And I
Well,
have to say the national board is doing a lot to further this field. Hopefully, we're getting more for healthcare, for reimbursement, which is awesome. And yeah, so lots of good stuff coming, which is very exciting.
great.
honestly.
Um, so I'm curious, Janet. So, why would somebody be looking for a health coach? Like, who are the people you're seeing, and how do they come to you? Like, what
Yeah,
would what would make me want to find a health coach?
yeah, that's such a good question because um, I think we think, well, I know what to do, and I just have to make myself do it, right? And we all know what to do, and then we're stuck in this gap of the recommendations and then not doing it.
Mm.
And that's what a health coach does, is it helps to fill that gap between what you should be doing and the process for doing it. I actually just interviewed somebody for my podcast, Janet Frank, who does emotional eating, and she described it so well in terms of coaching and just basically like, to give yourself time to meet yourself where you are and to understand what's below the surface of that. Let's get to the root of what's getting in the way. And clinicians don't have time to do this, right? If you recommend exercise, you don't have time to then talk about all the nitty gritty of what's getting in the way, or you recommend a certain diet, or improved healthy eating. The details are what matter. The beauty's in the details, right? Just like medications, right? Like how many times a day, how often, what's it going to interact with, all of those details that pharmacists give. That's what health coaches can kind of help someone figure that out. I think what's important is to understand that what health coaches cannot do, just like other clinicians, is they can't prescribe exercise. So there's also this gap between exercise recommendations and exercise prescription, in that there's a scope of practice, right? We all have a scope of practice of what we can and cannot talk about, right? Like I can't prescribe a diet for somebody. It's not of my scope of practice. I can talk about healthy eating as a health coach and even as an exercise physiologist, but I can't tell someone what to eat like a dietitian can. And so the scope of practice for somebody to prescribe exercise for somebody with chronic illness who can use it as a medicine is limited to clinical exercise physiologists and physical therapists, occupational therapists, maybe athletic trainers, all within their scope. And each of those have a very different, practice or practical application of that. But physicians, dietitians, health coaches, psychologists can recommend exercise, but cannot prescribe it.
So you actually have a very unique ability here of being a national board certified health coach and a clinical exercise physiologist. Like
yes,
that's just magical.
Yeah, exactly. They really do. And because I got into coaching because as an exercise physiologist getting out of grad school, and I went to cardiac rehab, and my first day I was like, okay, everyone's going to be so motivated, and they weren't. And then they kept coming back and saying, oh no, I didn't exercise, or they'd struggle with it. And we would create, continuation maintenance programs so that people would want to continue exercising, and they weren't getting that intrinsic motivation. They were mostly motivated by fear. And once they got a little distance from the heart event, then the fear went away and they weren't motivated so much. And so I got very curious about what makes people motivated. And then, health coaching and the training really gave me those skills to build that self-efficacy, that intrinsic motivation. That is the key, right? It's so we can have the best trainer and the best apps and the best incentives, but we're not going to do it if we're externally motivated. We have to have that intrinsic motivation. And so, so it's combining the health coaching with the exercise physiology, putting that missing piece that I didn't get in exercise physiology school. But as a clinical exercise physiologist, I can do what other health coaches cannot do specifically for exercise for people with chronic disease.
So interesting. So shout out to a LinkedIn colleague, Janet, for sending another Janet, one of my other favorite Janets. She sent me a video a little ways back, and it was looking at a Stanford University MD that was really going through kind of she wrote a book, I believe, in metabolism, so there is some bias, right, that comes with it. But really talking about this, our Janet of WOW, she was looking at, this is how I was trained at Stanford. And it did not include the ability to understand nutrition, not the ability to understand, diet and exercise combinations, not the ability to be able to motivate patients to be able to do things for themselves outside of how can I surgically treat them? How can I give them a drug? How can I continue down the same pattern that healthcare has given us? When we were talking about the episode today, that just came to my mind immediately. Like I've got to have Janet her take on those kinds of messages coming from an MD saying, I feel ill prepared to take care of patients the way that you just talked about, Janet. Your thoughts there, and where you think those kind of gaps are occurring, why the national certification is necessary, things that patients and clinicians need to know.
I think that we've set up doctors in a really awkward position, right? Go get cleared by your doctor to exercise. And doctors are like, I don't know how to do that, and because they're just not trained for it, but we put it on doctors to clear patients to exercise, to tell them they're okay to exercise. And that's not what they're meant to do. And the gap is caused by the fact that one, clinical exercise physiologists we're not reimbursable generally. Okay. That's starting to change a little bit. Where you see us is working in cardiac rehab or bariatrics or cancer clinics or diabetes clinics, but not always. If we're built into the system, yes, but if not, you're likely not to see one, even if you have a chronic disease. So
Right.
that's where the gap is, that then it puts it up to doctors or other people to just give these guidelines, just give these recommendations. And I had a client this week who was completely just stressed out about the recommendation from a doctor. She had a new medical diagnosis and she went to see her doctor finally after waiting 3 months to go see her doctor to follow up with this. And her doctor said, well, I want you walking 30 minutes, 5 days a week. I want you to add another yoga class. She goes twice a week. I want you to add another yoga class. I want you to do strength training twice a week. And she was completely stressed about it. So
Yeah.
she started walking. She started making herself walk and she got herself up to 20 minutes. But then she said she had to take ibuprofen to be able to sleep because her hip was hurting so much because she forced herself to do that level of exercise.
Yeah.
So now we have somebody in the chronic stress state because constantly hanging over her head is, I'm going to have a second event if I don't start doing this level of exercise that she asked me to do, and I can't do it, and medicating to exercise because they're in such an inflamed state from exercising, which is probably going to set them up for a disease state anyway. So the guidelines are great. They're mostly informed by self-report studies. We know what happens when somebody reports how much they do or how much they eat. They tend to underestimate what they ate and over-report what they did for exercise. And so
I brush my teeth 7 times a day if my dentist is listening.
Really? Yeah.
Yep.
Right? I'm doing everything perfect. I know. So self-report studies are informing those guidelines, and that means that they're a little skewed. When we look at physiology, 3 times a week for 30 minutes is enough to improve stamina. Once or twice a week is enough to improve strength, hopefully twice a week. But that can be done in small bouts. If you're doing 5 minutes, if you're doing nothing and you go to 5 minutes of cardiovascular exercise, you're going to improve your stamina. If you go from doing nothing to 1 day a week of one strength exercise, you're going to get stronger. But again, there's that gap, right? Between like, here's the ideal and here's where people are. And instead of saying, okay, what are you doing now? Okay, what's the next logical progression? And what would feel good for your body right now to get you out of the stress state? Instead, we're saying, okay, hit this marker. And again, it's setting doctors up because they have maybe 30 seconds to talk about this. So they don't have time to ask those questions. Again, this is where health coaching comes in. This is where clinical exercise physiologists to come in to take them through that gradual progression so that exercise can take them out of the stress state, not add to stress. And what I see right now is that it's adding to stress. It's adding to chronic stress.
Wow. I saw
Yeah.
something the other day, Jana and Donna, that you guys would probably think was interesting. So you may have seen, like, when we were doing all the smoking cessation training, right? All of us have probably encountered one way, shape, or form. It's either your kids telling you to stop smoking or grandma needs to stop smoking or whatever the case is. But the neat graphic was this, Janet, that reminds me of what you just said. And I'm curious in the exercise world if there's these same exact graphics. Instead of looking at stopping smoking or quitting smoking for the long-term benefits, like you quit smoking and then in 30 years, like you're going to feel a little bit better. It really broke down like, okay, here's day 1 where you stop smoking. And then in this much time, these are the things that start improving, like short windows. So people had little goals to be able to improve and to recognize the benefit of stopping smoking rather than looking at it as this daunting task to improve in 30 years from now. Thoughts, Janet, on that kind of mantra, how that works with, internal motivation, intrinsic motivation, and how it's used in exercise physiology and health coaching?
Yeah, exactly. I mean, it's our brain really cares about us being well now, which is why I call it Be Well Now method, because that's what our brain cares about. And so if my kids are sick, I've got to take care of them, and even though I know that the long-term benefit of exercising is going to be great for my health and my weight and all these long-term benefits, what's more important right now? Yeah, my kids are sick, I didn't sleep, whatever. And so the instant benefits then are, you know what, my kids are sick, I'm stressed out, I didn't sleep, I'm losing my patience. What if I pause for 30 seconds and do a little stretch break mindfully? I can clear that stress that stress state. And now I can go take care of my kids with a little more patience and a little more clarity, even though I didn't get to sleep. That's the way we need to start thinking about exercising in that present benefit, right? And how can it help me with what's going on right now? Rather than, and then the future will take care of itself, because the more moments that you're in that well state, the healthier you're going to be in the future. So we don't really have to worry about future health if we're taking care of now.
Mm.
Very interesting.
Well,
I like that. Yeah.
I love the idea too, Janet, that, oh, I got myself up to 20 minutes now, or a half hour, or how much ever time you're supposed to be exercising for, right? And I love this idea of um, being able to take these breaks during the day, right? So you're working, 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 and even setting a timer. All right, I got my 5-minute break. I'm gonna
Yeah.
I'm gonna use it for me and either stretch, walk, whatever it might be, and hearing that that is beneficial. So could you share a little bit more about that? Because when people hear, like you said, here's this whole stress, you need to do this, this, and this from what's prescribed by your doctor in order to exercise and get healthy and, be healthier 10 years, 30 years from now. How do we approach that? Okay, this 5 minutes is going to be beneficial. And what is some of the studies behind that, if you will?
Yeah, there are studies that show that it actually has a better improvement in metabolism, because rather than doing like a workout and then your metabolism drops as you're sitting at your desk all day, you get these little metabolism boosts throughout the day. So there's that, right? And and that people can fit it in better. They enjoy it more. They're more likely to stick with it when they do small bouts rather than one longer bout. Um, and I think people think, well, it's not going to be worth it. What's the point? You
Mm.
know, when we think of it as, I'm not going to burn enough calories, I'm not going to get my heart rate up, I'm not going to be doing 30 minutes, so why would I do 5? When we think of it that way, like hitting those goals, I think we're missing the whole point. And to me, stress is the hinge point for health. If we're in a chronic stress state, I don't care how perfectly you're eating, your body is putting more energy into fighting and fleeing and freezing against the threat, and less energy into healing, growth, and repair. And the more moments that we spend in that well state, the more our body can heal from diseases. It can fight illnesses. It can take care of us. So if we think of it like, stress is not the external things that are out there, the things that are causing us stress. Stress is the physiologic state. And the problem with stress is that when we're stuck in the stress state, so stress is not a problem. Stress is a really important thing. It tells us that something's wrong, right? When my dad had Alzheimer's, he didn't have stress. He didn't know that this was a problem, and so there was this disconnect. We need that stress state to tell us there's a problem so that we can take action to get back to the well state. That's why we have the stress state. So we can then say, oh, wait, hold on, I've got to stop. Okay, I've got to take care of this threat. The problem is oftentimes the threat is internally, self-criticism and all of that, or
Mhm.
externally, the news, the flood of information that we have, the overwhelm, all those things. So when we pay attention to that physiologic state of stress and say, "Ooh, I got to take care of this. Okay, what can I do?" But that stress state is caused from our thoughts going past and future, and so mindfulness gets it to the present moment. But mindfulness only takes us halfway. Our body is still ready to move. And so that physiologic state of being ready to move, even if you take a deep breath and you try to relax and you get back in the present moment, your body is still holding that tension, and that will accumulate, and it'll signal your body will signal your brain that there's still a problem. I
Hmm.
just was listening to Dr. Joe Dispenza's book, You Are the Placebo. Been out there a long time, but he's done a lot of research on placebo, which is it's such a great book. I'm really enjoying it. And just talking about how that brain body connection gets hardwired and sends signals back and forth saying there's a problem, there's a problem, there's a problem. So if we add mindfulness and movement to completely clear that stress state from our brain and our body, then we get out of the stress state, we get back to the well state. Another stressor comes, it comes back in. Stress can then become a cycle. Stress can work for us, and we can spend more time in the well state. So I think thinking of these little moments of exercise, not just to kind of even accumulate and burn calories, but at a way to get out of the stress state, um, And then if you organize them in terms of getting enough mobility, strength, and stamina, you can parse that out throughout your day. So you might take a little walk, and then you might do some strength exercises, and you might do some stretching, and get those three types of exercise. So that helps you age better than just getting steps. We need all three types of exercise. So I think of it in two ways. One, do it mindfully to get you out of the stress state, but organize it well so that your body's getting what it needs to age well too, maintaining your strength, stamina, and mobility, all three things.
Wow. Yeah, I think the the things that really hit me are, so the other day I was trying to start a piece of equipment and I'd let it sit around for a little while.
Mhm.
And like you guys already know, carburetors get gunked up, fuel goes bad, spark plugs no longer work, all of those things when something is just sitting there, right? Especially in
Mhm.
environments that are cold and hot and et cetera. It's really interesting because our bodies, like we would think that we were closer to like moss or lichens with the amount of time we sit and we were stagnant, Janet, all day. So when you're saying like the little pieces, like for people to think of when we're always in a, let's call it a recumbent position, for a long stretch
Mhm.
of time, what are the things that are happening to our bodies? Because you say the word stress, right? Or inflammation, how they kind of connect.
Mhm.
What ends up happening to our bodies when we were, most average Americans now are getting like less than 3,500 steps, right? So
Yeah.
pretty minimal amounts of movement overall. What does
Yeah.
that do for us? And why would it be so encouraging to just get those 5 minutes 4 or 5 times a day just
Yeah.
to start out with? What's the benefit there too?
Yeah. That's such a good analogy. I love it because it's true. When things are sitting still, like things build up. And I always talk about like still water, right? We have a frog pond in the backyard, and when it's still, all this stuff starts growing in it.
Mm.
Whereas moving water, things are moving through. Donna's seen my frog pond. I think our kids have actually been in the frog pond. We call it the redneck hot tub.
That's a nice one right there. I like that.
Only when we have parties and the kids end up in the frog pond. but but only when the kids were little. They don't do that anymore.
Yeah.
No, or they might.
I'd still get in that frog pond. I'll bet it's great.
um, so if you think about like the vessels in your body, right, when you're still and this stuff hangs out, but it's not just being still, because people can sit in meditation for hours and be fine.
Okay.
It's the stress state that starts to churn up. Your body says, oh no, there's a problem, you're going to need some fuel for that. Let me throw some fats and some blood sugar into your blood system so that you can fuel those muscles to fight, flee, or freeze against that threat. So it's the combination of stillness and stress
Nice.
that is the problem. It's not necessarily sitting. And I think that when we call sitting a disease, we're just adding to the stress. Now it's like, oh my gosh, oh no, now I'm sitting, and we're adding to the stress. And I think that we really need to be very clear that it's stressed and still. And so if you can take a moment to clear that, and that's literally what we're doing. If you do a stretch, right, and you feel that sensation of a stretch, what that is a muscle contraction, right? It's not the muscle stretching. Yeah, do it, right? Feel it. It's not the muscle stretching like a rubber band, you're trying to make them longer. What that is a muscle contraction. Your nervous system just said, oh, wait, you're pulling longer than I think you can handle. So I'm going to contract to support that, so you don't pull anything out of its socket. So that muscle contraction now is pushing against your vessels, and it's pushing blood and lymphatic fluid right through your system, just like a flowing stream, clearing that inflammation. But if you do it mindfully, you're not in a stress state. If you're doing that stress, like, I already got to get rid of this stress, then we're just adding to inflammation. So that mindfulness is really important. We've got to do it intentionally. And I think a big part of that is knowing how to move, which is where the clinical exercise and the movement science comes in. Because if you start stretching in ways that you did in high school, and that wasn't informed by movement science, and it hurts, we're going to be adding to stress and inflammation. So knowing how to move your body well now is really important, and learning those mechanics of moving in the body that you're in now allows exercise to lower stress. So yeah, the small bouts, add mindfulness, and picture that you are clearing that stress state, that inflammation, and keeping it lower. I think is really helpful. It shows how powerful it is. Like, wait, I can do something right now for this sitting disease stress state right now, just in a few minutes.
Mhm. That's
Wow.
wonderful.
Yeah.
So Janet, I know with my years of experience too, being a pharmacist and hearing, people's barriers, if you will, for Oh, no, I have to take that, why would my doctor
Mm,
prescribe anything that I wouldn't need? Or, "Oh, I have to have that," "I've taken that forever, it can't be that mad," like, all these things I think of, and my most favorite lines that I hear patients say to me, and the barriers basically around that, and how we have to work through those barriers in order to hopefully make a change with medicines that might not no longer be necessary, or might be causing more of a harm, um, than a benefit. So, what I'm getting at for you is I'm sure in your 30 years of experience, you've heard a lot of barriers.
yes.
So could you share now, and what I'm trying to think of is some of the things that, you know, patients or providers might be hearing,
Mm.
or patients saying and providers hearing too, that, how do we get around this too? So can you share some of those things, and maybe what are some points that we as either individuals or as providers can help people through those barriers?
Yeah. It's such a good question because it's true. I mean, we can recommend it, people know they should do it, and then, but it's, yeah, but, and there's a good reason we're not doing it. We all know that it's good for us and we want to be healthy. That's not the problem. It's the yeah, but all those other parts in my life are getting in the way. Um, and change is hard. Change takes energy. It's easier to stay in the same routines, right? So change takes
Mm.
energy. And so I think doing it gradually, a gradual change is one of the best things to do rather than this all or nothing. Getting out of this all or nothing mindset. In fact, I think there's three main mindsets that really create those barriers. And one is that, yeah, but all or nothing, right? Like it has to be this, or if I don't do that, in which we just talked about, right? So getting out of that and using those small bouts and thinking about, okay, what can I do to be well now? Um, kind of shift us out of that all or nothing to something's better than nothing, especially if it helps me to be well now. So the time piece, right? That I don't have 30 minutes and I can't get to the gym, the time to exercise, that's one of those solutions. Well, could you do a 5-minute walk at lunchtime? Could you do a little stretching before you go to bed? Could you, every time you go to the bathroom, just do a little stretch, Could you do some strength exercises every time before you eat or after you eat, or, pair it with something that's habit stacking approach. If you pair it with that stuff, then one of my clients love the microwave stretches, microwave mindful mobility moments. I love alliteration. So you put something in the microwave, you've got a minute time there, you just stretch at your countertop, like you're not doing anything anyway, probably, and it's a nice reminder. And so it's just like, I think, connecting it with those things, I call it linking, right? You link it to something you're already doing, but then you also link it back to your why. So it's not a should. It's like, oh, you know what? While this is in the microwave, I have an opportunity to get myself out of the stress state, get to the well state so I can do the next task with a little bit more ease and a little more joy and enjoyment and peace or whatever that is. So link it to the moment, but also to the why. And I think that's an important piece for providers that we often miss when these barriers are coming at you, and we start shooting them out of our head, out of our thinking. Um, it's missing a why. Usually, it's missing that intrinsic connection. So when we start with why, and we start with, well, what's important to you? What do you want to be able to do? Tell me more about why that's important to you. What are you going to be doing when you're feeling better? Um, then connect it to that why. You've got buy-in. Oh, you want to be able to play with those grandkids. You want to be able to get up out of the floor. Okay. Well, you know what? Strength exercises, specifically doing these exercises, could really get you there. Let's work on focusing on that. Could you put that in small moments in your day so you can go play with your grandkids? So now you've taken care of the time piece, but also there's other things I could be doing with my time that are more important, right? You
Mm.
ask someone about their grandkids, those are probably the most important things to them, and then that elevates the importance. So connecting it to why, making it small bouts, making sure it has that instant benefit, like you talked about, Kevin, like really focusing on the instant benefit, not the we're going to cure this disease kind of, but
Yeah.
how can you feel better now? How can this give you energy? How can it get you out of pain or reduce your pain? How can it make you just feel better? Elevate your mood. So focusing on those instant gratification moments. Um, and making sure that you're moving in a pain-free range. I think that's huge. Pain is a big demotivator that a lot of people don't even talk about because they think no pain, no gain. I'm supposed to be in pain. I'm overweight. I have bad knees. Of course, I'm going to be in pain when I exercise. And people often don't say that. But when I start talking to them, they're like, you know what, I would do it, but my knees are really hurting. And I don't think I could do that today because I've got to also do this. So addressing pain, talk about, does it hurt to exercise? Will it hurt to do 30 minutes? How about you do 5 minutes? Would that hurt? What's the pain for your pain reducing range so that we're not making it a pro-inflammatory? So usually pain, energy or time or, and motivation are usually those big three barriers that get in the way.
One I have to drill down on a little bit because it's been kind of cross conversational here is this kind of so cross conversational in my world. I've just had different people talking about this same subject in different ways.
Mm.
And so it's really this, Janet. You mentioned kind of those instant wins. So some things that people are doing to be able to measure if they're winning is look at their weight. So they're looking at that scale, which to a lot of people that are in the exercise physiology world and in the healthcare world that's growing, that scale is more like a four-letter word, like, oh no, like you don't want to look at that from a patient perspective. It can feel the exact same, right? So the interesting things that I've been reading on, Janet, that I'd love to hear kind of your thoughts on what can we measure and what should we measure or this.
Mm.
A lot of times instead of a scale, now we have this thing on our wrist or we have this thing on our finger or we have this phone that's calculating like, here's how well you slept last night. Here's where your blood pressure's sitting. Here's where your heart rate is, right? And so you have all these little metrics that are constantly coming after you. As we can all guess, sometimes those metrics cause stress. And there is a recent study that really looked at giving false information and what that does to an individual. So regardless of how someone slept, there's a study that they gave these individuals in the morning. They said, you slept really well. Your sleep score is really high. Guess what happened to those people? They felt great during the day. They felt really
Yeah.
Guess what happened to the people that even if they had a great night's sleep, their little machine
Mhm.
told them, you slept really poorly. They did worse, right? And so there's a really interesting piece of that placebo conversation you mentioned, the instant wins and the measuring. Like, how do we balance those things today, Janet? What are your recommendations in kind of that space that so many people find themselves in?
I'm doing a big sigh of relief. I'm so glad somebody's doing that research because and I'm so glad you mentioned it because I've seen this over and over again how like activity monitors cause stress. I didn't get my steps in. I've got to, and people are stressing out about it when again, it doesn't really matter. So I think of use the internal measures of success and then use the external measures as a guide. But the internal measures of success, which is why I use the word stamina, strength, and mobility rather than cardiovascular fitness, resistance training, and stretching.
Got
Those
it.
are things that we do and they can be externally measured. But mobility, strength, and stamina is something what you measure inside. Do I have mobility, freedom of movement? How's my stamina? How's my strength? I was doing strength training this morning and I thought, if we stopped calling it resistance training because that makes us focus on the resistance and
Yeah.
I think it makes people resistant to doing it and call it strength training so we can focus on the strength we feel in our body when we're doing it rather than how much weight you're lifting, but how strong you feel when you're doing it. And in that book, The Placebo Effect, he talked about that they have people imagining that you're lifting weights or visualizing lifting weights, and they actually got stronger
Yeah.
just by visualizing it or just imagining lifting a heavier weight, right? How powerful is that? So, so I think these internal measures and then having kind of what I call real results. Like, okay, if I have more mobility, that means when I get up out of the chair, I'm gonna have less stiffness. I will get up and out of the chair. So name the things that you're doing in everyday life that are now maybe more challenging or you can't do that you want to be able to do. I want to be able to get up and down off the floor with ease and make it very real life personal things you can do and use that as your measure. Okay, on a scale of 1 to 5, how well can I do that now? 0, I can't. 1, I can do it. 5, I can do it really well. And then measure that every month or so. Okay, how am I doing with getting up and down on the floor? How am I doing with walking, from here to my office without getting out of breath? How am I doing with walking upstairs without getting tired or having knee pain? Use those very real measures of how you're feeling and functioning. And then the Fitbit and all those other things can be nice guides, right? They might give you a little more feedback about that. But I think covering up the monitors on all cardiovascular equipment would be a really great idea, a good start. And I call it thrive tracking, to write down what you did and how you felt. You can put it in your phone, you can write it down, but just write down what you did and how you felt, because that's the piece that's missing. How you felt.
Mhm.
You did
I
10,000 steps a day. How'd you feel? You
I'm
know?
gonna grab that and ask you too on this one. So
Yeah.
Janet mentioned two things I want the audience to really key on. She said the word month. She didn't say by the hour. She didn't say by the day. And I may argue that you can look at weekly or monthly stats to be able to get a good idea and a reflective idea of how well did I do? Monitor my progress rather than a self-reflection judgment of, oh, I'm not doing very well, therefore I'm not as good as I wanted to be. But you mentioned something there. You used the word drive, and it makes me laugh just thinking about being a teenager and remembering driving. And you guys have taught your kids how to drive. And so with that, when you first learn to drive, you're extremely exhausted by the end of the day because you're making so many micro decisions that you think are important, right? Seeing this sign, looking at this building, seeing this car, like every bit of it matters. So the stress goes up and therefore the fatigue hits you by the time, a young teen driver. And I'm sure for parents, I haven't experienced yet other than like the little electric car the boys drive, but that's stressful enough. That ends up being really impactful. And you can see that the difference between a young driver and an experienced driver is they don't get as stressed, right? Overall, like it's an easier, smoother kind of experience for them to get from point A to point B. They're not thinking about hand position and where's the brake and how's my mirror looking right now and how so anyway, Jan, I wanted to see with your thoughts there when it comes to kind of the stress response, how is that similar to us really micromanaging everything and every detail of how our exercise regimen is going? And how do you free yourself from that?
Yeah, that's such a good analogy. And as I have a 17-year-old right now who I'm sitting in the passenger seat while she's learning to drive. So I have to practice a lot of stress management with that. And no, she's doing great. She's doing great. But yeah, I mean, it is, and it is. We have to really think about that change is hard, right? And we need to really appreciate the fact that change happens really gradually. And when it does, then we end up thriving just like a plant. It has to grow slowly. We can't stand over a plant and be like, grow, 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 grow. You'll stress it out. And you can't make it happen any faster. So yeah, I think having all of this input is really, we only, some people love it. Some people love it. I have a client who loves numbers and she counts herself to sleep and she loves the numbers. It calms her to have the numbers. And I have other clients who are they're more like me, where they're more averse to numbers and they need more visuals and more conceptual kind of things. So really knowing yourself, right? And knowing what calms you, what makes you feel better, not mentally, not in that logical way, but really how you feel. How do you feel when you look at your activity monitor? How do you feel when when it says you only got 1,000 steps a day? But how do you feel in your body? How's your energy? And I think of pain and energy are our best guides. They really are. If something lowers pain and it gives you energy, it's putting you in that healing state. If it gives you pain, including soreness, it's lowering your energy, it's putting you in that stress state. So pain and energy are your best guides, and only you can measure those. But some people like the numbers in terms of like, oh, I'll put it on a scale of 1 to 10 or something like that. So yeah, simple paper and pen, notes in your phone, whatever, just writing that down, I think is the best technology. I think of it like we have the best technology built in. We're smarter than AI. We're smarter than any best technology out there for measuring our fitness level. When we learn how to listen to our body, and that takes mindful self-compassion. It's hard when your body says you can't.
How do you ask your clients to document that, Janet? You said pain and
fatigue, pain and energy.
Okay, pain and energy.
Yeah.
How do you ask them to document that when they're going through the first phases? Because you said you don't want them to concentrate too much on it, but how do you ask them to gauge that with improvement?
Yeah, so if they like numbers, or they could use emojis, to write down what they did. Okay, I walked for 5 minutes. What was my pain before, during, and after? And did it get better or did it get worse? What was it like later? So just noticing, and that's where the mindfulness comes in, because I think that you have to measure pain very carefully. Energy is often easier to measure. Pain, the pain scales aren't great. We don't want people to identify with the pain. So that's
Right.
where mindfulness, that curiosity of mindfulness, like, oh, that's so interesting that I bumped it up to 20 minutes from 15 minutes and now my hip hurts at night. That's so interesting. Gosh, okay, what can I do to help? And that's how I describe mindfulness. Is mindfulness is has self-compassion in it. It's like, oh, wow, that's so interesting. What can I do to help? It's that way of relating to yourself. Oh, that's so interesting that I have pain. Not, oh God, my body is so old, and that line of thinking. But catching yourself when you do that and say, oh, wait, that's so interesting. I had pain. What can I do to help? Okay, maybe tomorrow I'll go back to 15 minutes and see if that works. Let me see. And think of it like an experiment.
Awesome.
And that's really the essence of coaching, is experimenting,
Mm.
not setting goals and meeting them or failing. It's really, oh, okay, that didn't work. What'd you learn? Okay, what was good about it? And that coaching conversation helps you bring that out with less self-criticism and more presence to learning about yourself, so that at the end of a stint with a coach, you have built such a great self-awareness and those skills to self-coach, you know, and that's really the goal. I made my program 6 months long because I don't want people to endlessly pay me. I want them to get the self-efficacy to do this on their own.
I feel like as a clinician for Donna and I just really learned a new thing to ask my patients instead of asking about diet and exercise and the amount of time they're doing it. Those pieces that you're saying, like, what are your energy levels like, or how are you feeling about this, or what kind of experiments have you tried to feel better? Like, that's great kind of
Right.
mindset switching on the way you're asking those questions to be able to get very similar answers to what we want to have, but a new way to approach it. Thank you for that, Janet.
Yeah.
And,
Yeah, you're welcome.
not feel bad either.
Right. Yeah.
So
Yeah.
you're like,
We want to
oh, I
feel
haven't
better.
been exercising because every time I walk, my hip is really sore later
Right.
on. It's like, oh, okay, well, then we have something to address here.
Yeah, I think when you address pain and energy, rather than talking about, what you should be doing for exercise, but how's your pain? Let's see what could get you out of pain. How's your energy level? People want to talk about those things. That's what they care about, right? That's that instant gratification. You think about when you're tired, you're going to look for a way to have energy, no
Mhm.
matter what you're going to do. When you're in pain, you're going to look for a way out of pain. And if you can give them a way to move, to increase energy and get out of pain, that's huge, right? Less meds.
Yes.
Or other substances.
So, Jan, um, I'm curious too, because I just think it's so important. I'm thinking about the caregivers out there too, and like, oh, that's all well and great. How do I get my older loved one to move? And I think it's so important that people know that people can start moving, even if they're lying down or sitting. You don't have to be up and, have to walk kind of thing. So could you just share a little bit about that? Like the lowest low that you've helped people through? Because I know you've helped a lot of people through some very tough setbacks in their life. And how were they able to progress to go from that 0 back to, wow, I can actually feel good again?
Yeah. Oh, that's such a good question, Donna. I know that you've done this, with family members and stuff. And this is, I think the most important thing is to meet people where they are. To just say, okay, this is where you're at. You can't get out of bed. Okay, what can we do right now? What can you do? And to help them meet themselves where they are. It's so hard to be limited. So giving lots of empathy and compassion in a strong way to say, okay, yeah, I get it. You're in pain. You're tired. Let's see what you can do. And even if it's starting with visualizing, how about you close your eyes and you visualize yourself playing tennis or doing something, knowing that that can have a placebo effect, and sharing that with people so that they really know that is a worthwhile thing to do. I think of even just like squeezing muscles and releasing them, kind of keeping that brain body connection between the brain and the nervous system and those muscles, and moving parts of the body that aren't affected. You have a broken foot, can you move your upper body? So thinking about what you can do rather than what you can't do, and starting at a level again that gives you energy and lowers pain, even if it's one rep. Even if it's whatever makes you feel better. It could be one rep 3 times a day, and then it's one rep 4 times a day. um, and and progressing at the pace again that makes you feel better now, so that that person sees it as an empowering thing that they can do, right? We lose our sense of autonomy when we have an injury or an illness, when we're laying in a hospital bed, when we're sick. And I think that's one of the hardest things, right? When we just feel like, "Oh, I can't do what I want to do, and I'm so far from where I want to go." To share this great information that something's better than nothing. And even if you're visualizing, even if you're doing these small bouts, they really, really can help. And then to help people be guided by what they know inside empowers them to say, yeah, you can do this. So I think small bouts at a light level, starting really light, range of motion. I do a lot of starting with just range of motion. And it's, when somebody has an injury, let's start and let's do the range of motion that's pain free. And even if it's just this, let's start with that. Okay. And then if you're exercising in a pain free range, your body cannot help but get stronger. And then your range will improve. And so, and even if we're just preventing a loss, right? If someone has, they're in the cancer treatment and they're so exhausted and so nauseous, if we can at least prevent a loss of strength, stamina, and mobility, and maintain and keep your head above water and maintain those levels, that's progress. If you're not going below the water level, you're making progress. So even maintaining in those situations is progress. So a lot of it is reframing, and that talking about it in a way that provides that hope and belief that something is better than nothing. And a lot of it is that mindfulness and that self-compassion to say, okay, what can I do now? And this is hard that I can't do what I want to do, but I'm gonna do what I can to take care of myself.
Yeah.
Yeah.
And I'm thinking even with caregivers, if they're able
Yeah.
to emulate or,
Mhm.
show that's something that they're doing
Yeah.
for themselves
Yeah.
too,
Um,
versus, being in this stressed care mode, which of
yes.
course, you can understand that they would be in that. So,
Yeah. You're
um,
right. I'm so glad you bring that up, Donna, because it is the ripple effect of healthcare is the caregivers are the
mm,
ones who are getting sick.
yeah,
Yeah.
for sure. For
Yeah.
sure.
Wow.
Can we also just shift gears to, so I know we talked about those that are like wanting to start and, maybe, um, don't have the time or the 30 minutes or things like that.
Mhm.
How
Mhm.
about those that do have the 30 minutes and just want to, even get better, right? Or
Yeah.
so what about that, Janet? And I'm assuming it's going to follow some similar basics, but when people are just so ultra motivated,
Mhm.
and how do we make certain that they're actually doing this in a manner that is helpful to them, that they're not stressed? Like I'm just thinking about some people that are like, I got to get this in, I got to do this, and they're doing it all the time.
Mm.
Like they're 30
Yeah.
minutes, but it's a stressful 30 minutes to get it done. And then
Yes.
they're fitting it in kind of thing.
Mhm.
So tell me a little bit more about that, if you will, like people who are doing it, but how can we be better at those 30 minutes or that hour, or whatever we might put towards our exercise?
Yeah. I have an image of somebody like walking on the treadmill, reading a book, listening to music, kind of watching TV, like multitasking all of it, and like, okay, I got to fit it in, but I also have to do this and I have to do that, and talking on the phone. And so the first thing that comes to mind is multitasking, like looking at what you're doing and the quality rather than the quantity. Is
Yeah.
it a time that you're adding to stress? Like, are you watching the news while you're exercising? Which is just going to put you in a stress state. Let's face it, there's nothing you can do about it. And watching the news is probably going to do that, unless it's calming for you. But, again, it comes back to that individual response is paying attention to if you're multitasking to distract or to enhance. Are you distracting just to get through to check the box to say, okay, I got my 30 minutes of cardio in today, check it off? What we're practicing is distracting. And the more we practice distracting, the more we're probably going to do it when we're eating, the more we're probably going to do it when we're talking to a loved one, the more we're probably going to be really practiced up in distracting when we're doing something else like driving. And so, do we want to practice distracting? I don't think so. We want to practice being present, because presence is really what's going to really enhance our lives in so many ways. So, but it doesn't mean that you have to like meditate while you're exercising, although that works really nicely. What keeps you present while you're exercising? And the moment you shift to thinking you have to distract to get through, that's a red flag to
Mm.
say, is this quality time? Or am I just going for quantity and really I'm practicing something that I really don't want? I don't want to be more frazzled. So think about what you're practicing during that time. Am I practicing being stressed or practicing being well? And how can I reorganize it so I'm in the well state? And so I think that's one. Two is getting a balance of strength, stamina, mobility. I see a lot of people overdoing cardio, way too much cardio, thinking they're burning more calories because they see on the machine that they're burning calories, or their activity monitor told them they burn more calories, and underdoing things like mobility because it doesn't get a lot of kudos on the activity monitor. And like I said,
Mhm.
doing stretching mindfully is one of the best and easiest things that you can do. And so we have a lot of people who are kind of stuck in a movement pattern of walking or running because that's what they do so much. And they really can't lift their arm overhead anymore because they never do that.
Yeah.
So we get to keep what we use. So we want that balance of strength, stamina, mobility. And within that, we want to do a variety of things that are very related to what you want to keep. I want to keep the ability to lift my arms overhead. And I want to keep the ability to lift heavy things off the floor. And I also want to keep the ability to move and move for longer distances. So organizing it in that way and making sure you're doing a balance. Plus, it's one of the best ways to prevent injury. Most of the injuries that I see are overdoing cardio and underdoing stamina and mobility. I mean, strength and mobility. So getting a balance of those three types, like alternating days of strength and cardio, I think works really nicely, especially if you're predetermined for weight bearing pain.
Mm.
um, Getting a balance of those things and then little stretch breaks throughout the day. So splitting them up and parsing it out so your body really gets a balance, just like our body needs carbohydrates, proteins, and fats. Our body needs strength, stamina, and mobility. Yeah.
Wow. Yeah, I think
That's
the healthcare world is an interesting space for those three in general. I think the distraction you mentioned, Janet, I think all of us in the healthcare space know that we live distracted lives ourselves, let alone our patients, trying to push that
yeah.
across. And so I really appreciate you drawing in the ability to look at your own like well-being and realizing that you get to keep what you use. Those sayings I think are beautifully put together. And I do have to say this for the audience listening, you guys all notice that Janet usually takes something that is a negative phrase and she reverses it somehow, which that's really
Always.
but I do think that those people,
If I need my positive pick me up, I just call Janet.
there you go. You can just flip it on a dime. Man, that's so helpful. But
It impresses me incredibly.
the decompartmentalizing with Janet. No, I think the one thing I wanted to kind of hit on there is it's interesting that from a parent's perspective or a caregiver's perspective, right? If we are living a frazzled, broken, distracted kind of lifestyle, and that's the way that we operate, those that we're caring for, our children, our loved ones, our patients, like they're picking up on those exact same signals as normal. Like this is the normal way to operate. And so I really love the call out there to do these things purposely and also recognizing the ripple down effect of you doing these things on purpose and being conscientious about, really appreciating the moments, even if they're small, to
Yeah.
be able to appreciate those moments that you're taking care of yourself and doing the right thing. So that's beautiful, Janet.
Yeah.
Yeah. Thank you. I have to say that the positivity, or the ability to kind of switch things is really a practiced skill, right? We know this. We know that if you keep a gratitude journal, you're more likely to see things that you appreciate. So that's why I am so passionate about adding mindfulness and self-compassion to exercise, because it allows us to see clearly. Oh, I'm exercising and I'm beating myself up the whole time, or my head is on that fight that I had with somebody and I'm reliving it while I'm exercising, and I'm just reinforcing it in my body, versus I'm going to exercise and appreciate what my body can do today. I'm going to listen to it and give myself lots of compassion when I have pain when I'm moving, to say, oh, okay, all right, this is hard. I wish I could do this the way I want to, but I can't. What can I do to help? So I have to say it's a practice skill, and I can get in the grumpies and I can get really negative and self-critical and all of that. But mindfulness wakes up and says, oh, that's not, you don't really want to be there. What can I do to help? Okay, let me get into gratitude again. So, so I think if anything, it's a plug for, let's repurpose exercise as a time to practice what we want, not just for our bodies, but our brains and our hearts too. We want them all to function better together. And I
Smart.
think about this, like I think of it as whole person healing. And every time we have a diagnosis, there's a change that happens between our brain and our body becomes a threat. And we can do really well at healing the body, but we don't necessarily heal that. Or we can go to a psychologist and help heal the brain, but we don't heal the body part. I think of this as whole person healing, that it's a brain, body, heart healing. That if you have heart disease or diabetes or cancer or something, we need to heal that, or we're going to have a lot of leftover, right? I have friends with cancer who had cancer, and then every time they have to go for a scan, it brings up that stress again. If there's this constant worry, it's going to come back, understandably,
Yeah.
but that's keeping us in the stress state. We need to heal that fear. And to me, this is the way to do it in our whole person.
Beautiful, like always, Janet, for sure. Donna, any last questions for our esteemed guest?
No, I've actually been writing them down and she's covered them all. But Janet, I just want to say thank you again, as always. You put things in such a great perspective for folks. And I love the fact that we've gone through, those that aren't exercising to those that are. And we've really run that whole gamut as to just really that whole thoughtful and well-being around exercise, and that we can fit it in either 5 minutes or 30 minutes, but let's do it mindfully and respect ourselves while we're doing it.
Wow. No, fantastic.
Thank
And
you.
Janet, any parting words for the audience or any links for them to be able to find you at?
I just want to first thank you guys for what you're doing, because the deprescribing is just, it's huge. I mean, you've made me more aware of patients' medications and client medications and the effects of that. So thank you for what you're doing. And yeah, exercisingwell.com or at exercisingwell, exercising, ing, well, WLL. And that's easier than going through the spelling of my name. So exercising well. And my goal is to put out good resources. So yeah, so please go and take all the resources that you can get from there, because I want you to be well now.
Janet, what's the name of your podcast that you have now?
Oh, it's the Be Well Now Method podcast. So I use the Be Well Now method in various ways on there. I'm having a lot of fun with it.
Oh, that's so much fun. Well, make sure that you guys go and check out Janet. Thank you all for listening in and for your attention to such an important kind of piece. And Janet, thank you again for your time. You're always such a wonderful person to feel re-engaged with life again about. So make sure you check out Janet's content and feel re-engaged with your movement and pain-free and mobility kind of abilities. But until next time, we are on YouTube, Facebook, LinkedIn, Spotify, Apple, all those places. Check us out. Lots of great, wonderful guests just like Janet. And until then, we will see you guys next time. Bye-bye.
Thank you.